Thank you for coming. So I'm gonna present the program that we've been working on this summer, and it's titled Empower Me, and the Me stands for menstrual education. And this is our initiative for our menstrual hygiene kit distribution program in Siaya County to be run between September and December of 2024. So for the sake of the recording, and anyone who's gonna watch this later, I just included a little Project Juani information slide. This is a little snippet from our website. It has our mission and vision statement. And if anyone is interested in looking into us further, I included our website link. It's just juani.org. So yeah, and then I'm gonna hop into a little background on menstrual health and hygiene, specifically in rural Kenya. So the problem that we are assessing here is inadequate menstrual hygiene management, or MHM. The WHO and UNICEF defines adequate MHM as the proper use of menstrual products, sanitation facilities, accurate knowledge, safe disposal of products, access to affordable materials, health services, and just having positive social norms surrounding menstrual health. And this is, it's a big issue across the globe that not a lot of places have perfectly adequate MHM, and it's something that's being looked into a lot more in the last decade. So inadequate MHM is heavily linked to poverty, social stigma, poor infrastructure, and then that leads to a lack of education, facilities, materials, and research behind it. And the issue that we saw in Siaya County and in many rural areas across the globe is that inadequate MHM causes discomfort and embarrassment and fear for the girls in these areas, and that in turn affects their education and economic opportunities. What happens is that girls will often not come to school or they'll drop out of school when they reach menarche, and that, of course, leads to poor economic wealth and pure health and just perpetuating gender norms regarding menstrual hygiene and sexual and reproductive health as a whole. And I included some statistics down here, kind of highlighting the issues with accessibility and facilities, and social stigma in Kenya itself. So that kind of, shows what research has been telling us for the last 10 years about how women felt about their menstruation and discussing their menstruation. And that kind of leads me into, what are the determinants of this issue? So as you can see here, about 40% of Kenyan families are living below the poverty line. This plays a role because obviously you need money to buy your menstrual products, specifically keep rebuying um, reusable products, so like sanitary pads and tampons and things like that. So that, living below the poverty line, not many people see menstrual pads and resources as something that's necessary. So it limits people's access to these products and it forces girls to use unsanitary alternatives. Some of which include, using gauze or pieces of cloth again and again, which is obviously unsafe for their health and can cause disease transmission and all of that kind of stuff. Another issue is challenges in infrastructure within schools and within, villages and homes. WASH infrastructure, which stands for water, sanitation, and hygiene. It's very expensive. And again, not a lot of people see this as something that's a necessity. So it prevents them from providing this infrastructure, and that leads to poor support and access to this stuff for menstruating girls. Then there's, of course, our cultural stigma. Menstruation is seen as something that is contaminating or impure, and this is what causes girls to miss school because they feel embarrassed or ostracized, and oftentimes they will not discuss it with anybody out of this same embarrassment and shame. And that kind of leads to an inadequate education regarding menstrual health and sexual health as a whole. A lot of this education in Kenya focuses on biology rather than practical menstrual hygiene management, things like pain management or hygiene, things like that. And that causes many teachers to also be untrained and unprepared to teach it. So it introduces a disparity in, what education you're even getting regarding your menstruation. And then, of course, tying everything together is the sanitation issues. Because of all of these factors, schools won't have clean private facilities for girls to change their sanitary pads, and not adequate disposal options, which also contributes to environmental issues. So all of this kind of ties together to create inadequate menstrual hygiene management. Looking at our target population for this issue is the women and girls in rural Siaya County that have reached menarche. So, while there is some early childhood development education in Siaya County and vocational training facilities, there's still a lower enrollment rate and a higher dropout rate for girls in primary and secondary education compared to boys. And I've also included some statistics on this slide to highlight, um, what women experience in regards to their treatments for sexual and reproductive health and diseases, and what sanitation does exist. And as you can see, some of these numbers highlight a pretty large gap, and this contributes to the economic challenges that women face later on in their lives. There are existing recommendations for action regarding this topic. In 2019, Kenya published their menstrual hygiene management policy, and this calls for increasing awareness about this issue, ensuring access to affordable products, providing adequate hygiene facilities, and overall reducing stigma. And so some of these strategic actions that they called for included education for community leaders, and this also includes involving teachers in the process of providing menstrual hygiene education, and then also education for students of all genders, so including boys in the process of educating. And also they called for free and subsidized product distribution. It is like as I mentioned, it's difficult for women to access sanitary pads sometimes because either they might live too far away from a place that is selling them, or they won't have the economic funds to procure the pads, or tampons, or whatever products they prefer. And so it calls for a free distribution of a sustainable product. And that brings me into the environmental considerations. So having reusable menstrual hygiene products and kits is recommended. Something that's washable and that can be dried in the sun, that women won't need to purchase anything else to take care of, was recommended because it's something that is environmentally conscious and is sustainable, and that can last women and girls many, many years without them having to purchase something new. So that leads me into describing our program that we've developed here. And I'm going to touch on our, very general goals of this project, what activities we have planned, the partners that we have on this project, our budget, and then finally how we're going to be evaluating our first run of this project, which, as I mentioned, is from September 2024 to December 2024. So first, our general goals and objectives. We want to provide sustainable products to students in Siaya County. We want to reduce stigma in this area through educating both boys and girls on menstrual health. We want to reduce school absenteeism and dropout rates and provide students with the background that they need to utilize menstrual hygiene resources effectively. And finally, we want to empower teachers to provide reproductive education to their students. And the overall, idea here is we want to empower girls to make their own health and economic decisions. And yeah, these goals are very general. I'll get into this more with our evaluation plan, but once we evaluate this program, we'll be able to better hone our goals down to specific numbers that we're looking for, so that we can measure it more effectively. So we're going to have two main activities in this program. We're going to have distribution and we're going to have education. In terms of distribution, we want to distribute 55 Mooncatcher kits to girls in grades 6 to 8 at, I'm so sorry if I mispronounced this, Luero Primary School. We chose grades 6 to 8 because according to a study done at the NIH, grades 6 to 8 and the ages of around 11 to 14 are going to be average ages of menarche in Kenya. So we thought it would be a good idea to introduce Mooncatcher kits to girls during that age. And I'll also get into what Mooncatcher kits are in a minute. We're also going to distribute menstrual calendar bracelets, which I will show you, and we are going to distribute Juani branded pencils to the boys in these classes. And a big shout out to Sarah and John for donating Juani branded pencils to us for this phase of the project. We're also going to be conducting some education. So, we're going to be conducting menstrual education sessions at the targeted schools involving both boys and girls. Following Juani's it's in development, our menstrual education curriculum. And we're going to empower teachers in the area to carry out more sessions once our on-site intern leaves for the summer. So first, our distribution program. So before I get into that, I'm going to have to introduce the Mooncatcher Project, which is one of our partners for this project. I've included the impact statement and mission, vision, and values on the screen here. So essentially, what they do is they work all over the world in many different countries, and they establish sewing cooperatives where they empower local women in the area with the skills to create reusable menstrual health kits. And so, for example, they have a sewing cooperative in Kisumu, and a quote from their website was that the Kisumu sewing cooperatives make kits and distribute them to girls in nearby schools. And they teach girls about menstrual management and reproductive health. So we wanted to take their program and apply it kind of to our target area of Siaya County. And so what they do in these sewing cooperatives is they create, as I said, reusable menstrual hygiene kits. So these are called moon catchers, and they're made of cotton with a piece of Tyvek between the layers, and they're kind of built into underwear, so that girls don't feel embarrassed using them and carrying them around and doing whatever they need to do with them. If you want to read more about Mooncatcher, I also linked their website. It's just mooncatcher.org. So this is kind of an image taken from their website that showcases the kit here. So as you can see, that carrier, that part is what's built into the underwear, and they have a waist tie, and they have size adjustment so that girls of all sizes and heights can wear their pads. They have a waterproof bag to hold their dirty pads until they can be washed. They include a calendar so that they can track their cycle. And then they have some instructions on how to care for their bags, which I'll show you a blown up photo of later. And then they also come with a branded drawstring carrying bag. And we will be using our own Juani branding for the drawstring bags. So, these are the partner schools that we will be working with. So again, I'm sorry if I mispronounce any of these, but we have Luero Primary School, Sega Township School, Dirajo Primary School, Lifunga Primary School, Uyundo Primary School, and St. Joseph Oching School. And I included their distances from our Wilson Center there as well. And so as you can see, Luero Primary School, which is actually Maureen's primary school, is the furthest from the Wilson Center, but we are going to be using this because they have about 50 girls that are of grades 6 to 8, and that fits nicely into how many kits we're able to distribute for this first phase of this program. So Yeah, that's why we're going with Luera Primary School as our pilot school for this program. But at the rest of the 5 schools, our on-site intern, LaDaisy, is going to be conducting, education programs, and we're also going to distribute our menstrual hygiene bracelets, which I will show you a picture of in a few slides. This is our general activity timeline. So our on-site intern, LaDaisy, will be there for around 6 weeks. So at first, LaDaisy and our on-site supervisor, Maureen, will visit the Mooncatcher facility in Kisumu and bring mooncatchers back to the Wilson Center and to Siaya County. And during this time, they will also build a team of knowledgeable trainers that will deliver menstrual health education once LaDaisy leaves. The second week will include adding our Juani calendar bracelets to these Mooncatcher kits, and to put up a Mooncatcher kit drying line at the Wilson Center so that if girls need to, they can come and dry their kits at the Wilson Center. And that will also include holding training sessions um, for these educators that they have recruited in the past week. Finally, week 3, for this first part will be to start distributing these 55 Mooncatcher kits, and those pencils to students in Luera Primary School. And LaDaisy and Maureen will provide education on menstrual health using the kits to all of the students in this school, so to the girls and the boys. And this is the second 3 weeks, so during week 4, LaDaisy and Maureen will visit 3 other partner schools, and they'll determine which ones, what's the most efficient way of traveling around Siaya County, once they're there. And they will provide menstrual hygiene education and curriculum to all students, and they will also be doing this the week after that with the other, 2 remaining schools. And finally, in the last week, LaDaisy will go back to Luero Primary School, and she will conduct the first steps of our evaluation plan. So this will include follow-up surveys with students and educators at Luero Primary School. So hopping into our education, most of the curriculum is being developed by LaDaisy and Sarah and the rest of the Empower Me team providing support. So here are some details of our 2 different curricula. So we have our boys curriculum, which they'll be learning about the menstrual cycle, why menstruation occurs and its significance, and how to support their female classmates during menstruation. The idea here is that if boys are more acclimated with what menstruation is, and if they're, more understanding of how it's natural and the reasons why it occurs and how that relates to their lives. They will tease girls about it less and they will provide more of a support system for now and for, future generations. And they'll also be receiving the Juani branded pencils that Sarah and John have donated for this project, just so that they are also getting something, while the girls are receiving pads so that they don't feel unequal or upset that they haven't received anything. And then the girls' curriculum will include the menstrual cycle, menstrual anatomy, why menstruation occurs and its significance as well, how to use sanitary pads, and then also the girls at Luera Primary School will learn how to use mooncatchers. The diagram provided by the Mooncatcher project, which is also included in the kits, is this 3-step diagram right here. So it includes how to load the pad with the Tyvek, the soft layer of absorbance, how to wash it, and then a reminder to dry it on a line in the sun. They'll also learn hygiene tips, and they'll also learn pain management tips that, such as drinking water or using warm water and things like that. All girls at all schools will be receiving, menstrual cycle bracelets, so that they can and I'll show you some images of this as well. And then the girls at Luero Primary School will be receiving their moon catchers. These are our beautiful menstrual hygiene bracelets. Um, I just think they're so wonderful. And this is kind of a zoomed in picture of what it's like. So as you can see, there are 23 beads, 23 white beads here, and then 5 red beads. So this kind of symbolizes the menstrual cycle, which is typically around 28 days, 23 days, and then 5 days of bleeding. And so this is a snippet from our curriculum right here next to the picture of the bracelet. And this is something that the girls will also receive. And this is just an example of the 5 days of bleeding and then the other 23 days. And it also highlights days of ovulation so that girls can understand, what's going on in their body. And it goes hand in hand with these bracelets here. So what the girls can do is to help them track their menstrual cycle, they can count the beads, on the bracelets, and that's when they'll also know when to start bringing pads to school or when to start bringing their moon catcher kits to school, so that they know, um so that they don't feel embarrassment for being unprepared in school for their period, and so that they're more likely to actually come to school even when they're on their period, while they have their pads. And here is another picture of Tiffany's cat with a different style of bracelets where we just have 23 beads, and the 5 red beads instead of here where there's 23 on both sides and 5 beads in the middle. So the girls will be receiving some variation of these menstrual hygiene bracelets. Okay, now on to our budget. So the total cost of this program will be around $630 estimated, but it will likely end up being less. The Mooncatcher menstrual hygiene kits will cost us around $7 per kit, and each kit comes with 3 pads in it. So that gives us 55 total units that will probably last the girls who receive them at least 4 to 5 years. Um, and the total cost of that is 385 US dollars for us. Um, but I spoke with Mooncatcher and they indicated that the cost will probably end up being less since we're providing our own transportation to Kisumu. And then we also have our custom Juani sticker branding materials that we will be putting onto our pads. And we're ordering 100 units, and those will probably cost around $24. And then we have our health educators for once LaDaisy leaves. Um, our health educators, we are planning to pay them $7 per session. So if they're able to conduct 20 sessions between the end of September and December, that'll cost a total of 140 US dollars. And then also our estimated transportation to Kisumu and between schools. I spoke to Maureen and she indicated that it wouldn't cost more than 4,000 Kenyan shillings. And then finally, our printing materials and laminating materials, estimated cost um, for printing out our menstrual hygiene education programs. This is going to be around $50. So this is kind of our estimated budget, but it's of course subject to change based on how much we do actually print and how much transportation actually is, and then how much our Mooncatcher kits end up costing. So finally, our evaluation plan, which LaDaisy developed. So the aim of this plan is to measure the at first immediate and then eventually long-term changes in knowledge, behaviors, and cultural beliefs surrounding menstrual hygiene within the community of Sega and Siaya County, within their schools, and to improve educational and health outcomes for schoolgirls in Sega, and also to determine the level of capacity that the schools actually have to provide this education and the capacity that the teachers have to continuously provide this education as they get more students. And finally, to analyze the cost effectiveness of the EmpowerMe program implementation. So the methods for this analysis are going to include surveys, so pre and post program intervention. So as I mentioned in the last week of the program, LaDaisy will conduct surveys with these schools, and these surveys will include assessing knowledge of menstrual hygiene and of puberty, attitude towards menstruation. So, how comfortable they feel with discussing it, how comfortable girls would feel bringing sanitary pads or moon catcher kits or any menstrual hygiene product to school. And then also what they know about menstrual hygiene practices, and then finally looking at their school attendance pre and post intervention. And this will do by looking at student attendance records within the schools. This is more of a long-term thing that we're going to look at as the program continues until December, continuing to look month by month at student attendance records and measuring how much of a change we have in female student attendance. And then also, LaDaisy will conduct some focus group sessions with teachers and some students and look over Project Juani's financial and accounting records to see how we could possibly make this program more cost efficient for the future. So a lot of the guiding questions for this plan include, are the EmpowerMe program education sessions conducted in a manner that's digestible and understandable for students and teachers? What the level of engagement was for students and teachers, reduction in absenteeism among girls who received kits and education, and the impact the program has had on overall academic performance, looking at if schools and teachers are equipped to continue this program without the support of LaDaisy, and then what the community impact is, and then finally, what did Project Juani lose or gain financially with the implementation of this program? Here are my references, primarily for the background section. And I just want to acknowledge the Empower Me team. Sarah, our Project Juani co-director, Sherry, our menstrual hygiene team lead, Maureen, our on-site intern supervisor, LaDaisy, our on-site intern, and then also Sarah, Tiffany, and Millicent for helping out with this project and providing me with guidance as well. Thank you. And then I'd also like to thank our bracelet donators. So we have Marciana, Kayla, and Tiffany. Thank you so much for making the bracelets and staying with us throughout this process. And then I also want to thank Ellie. She is the Mooncatcher project founder and executive director, who has been a very amazing communicator with me throughout trying to plan partnering with them and our kit distribution program. And I also just want to thank all Project Juani members for being a supportive environment throughout my internship here and for providing me with guidance and an amazing project to work on. And yeah, that's all I have for this program. Please, I'd love to take any questions at this moment. Thank you.
Thank you, Radha. That was amazing. You were so good. Okay. Yeah, so I'm getting lots of great feedback from you in the chat. I don't know if you can see it, but
I
everyone
cannot.
Okay, well, the comments
Oh,
are
there we
saying,
go.
great presentation,
Thank
well
you all so
developed.
much.
Okay, lots of great jobs, lots of claps. Yes, so it may surprise some of you to know that Radha is just entering her second year in her public health program at George Washington, right, Radha?
Yes.
Yeah, yeah. So just 1 year in, she is just great. So, um, yeah, thank you, Radha. Okay,
Thank you so much.
so let's see. If anyone has any questions that they would like to ask, we will just open the floor. I did mute all of you, so feel free to unmute yourselves if you'd like to ask a question.
I wondered how have the schools, you've already made the connections with the schools, you've already organized that. I wondered who did that. Was that LaDaisy or Maureen or and I wondered what the response was and you know how they're looking forward to it.
Yeah, Maureen actually is the one who coordinated it with the schools. I think she's here, so if you are able to come off mute and answer that question, that would actually be wonderful. I'm sure you can answer it better than I can.
Okay, hi everyone. I worked with Lennox to connect with the school, and they are really looking forward to this day, or to the education and us helping the girls with the menstrual hygiene kits. So yeah, the response was really great.
I had a question. I've gone through the intervention that are placed to help the issue of menstrual hygiene. My question comes, we are tackling about several schools. I've not heard of any intervention touching outside school, because at a point, these pupils or students will be out of school. But there will be a gap between school and home, and the interventions are only done at school. What are the plans that are placed to ensure we can reach the student, the girls, the adolescent girl at home, in the village, churches, and even at school, as already mentioned? Then two, the second one looks like maybe an idea. Have we thought of having something like a menstrual shop, like a center where we capture even yeah, at the market centers, we also have ladies who do trading, but a point you find they cannot carry out their activity because of the menstrual issues. Do we have an idea of maybe having such a center where we educate, we sensitize them, then we make the availability of the resources like the pads at a subsidized rate for them to get acquainted with everything that they need? Thank you.
I think for your first question, I believe you were saying how we can reach the girls at home at when they're at homes, not just in schools. Um I think that's something that we can consider definitely for the future. For this first part of our program, we thought it would be the easiest to coordinate with schools, especially since one of our goals was to reduce absenteeism due to menstruating. So that's something that we were thinking about just for our first program, but in the future, I would love to look into it further on how we can access girls that are just at home, that might already not be in school or things like that.
Yeah, thank you, Radha. That was a great answer. Yeah, so we're also a newer organization. So I think in talking with Maureen, we kind of decided to start first in schools just to make sure that our CBO has gained the proper acceptance by the community. Maureen, I don't know if you want to add anything else.
Yes, and also our target or long-term target is for these kids to know that Juani is there, and if they wish, they can join Juani, of course. And also, we had plans to have I don't know how to call them, this to have a place where those kids will be placed at Juani, at the Wilson Center. So in case they visit the site, or I mean they visit Juani, they can be able to have, I mean, to get those kits. I don't know, but that's something we can work on as Juani in the future.
Yeah, so somewhat limited by our very tiny budget, but yeah, maybe sometime. Your second question, yeah, I would love to have a menstrual shop. So we do have something in the works that my father is actually going to be working on. So we've seen in some communities in the U.S. Something that's like a period pantry. So we have that option to put something on our land at the Wilson Center. We're kind of still thinking through how it would be used and not abused. So would it be subsidized, or would the products in there be free, or would they only be open during certain times? Or, how could people access it but not just take advantage of it? So to be continued on that, but we would like to have some place within our Wilson Center where girls can come and access products when they need it. Does anyone else have anything to add to either of Nicholas's questions? All right, well, thank you, Nicholas. Okay,
Okay, welcome.
the next question is from Erin. So Radha, I'm just going to read it from the chat. In the evaluation plan, you mentioned tracking attendance pre and post intervention. Will you be collecting if each girl has started menstruation pre and post?
Yes, I think that's definitely something that will be included in the surveys so that we can, um, eliminate any kind of confounding factors, where, girls haven't started menstruation and then they have, and then attendance changes because of that. Um, so that's definitely something that we're going to be including, in what we're tracking, for sure.
Okay, great, thank you. All right, so one question I had, well, two questions actually. So one thing is, I know we had touched on, maybe not so much in this presentation, but in our discussions, one of our big concerns is that based on our conversations with uh, people who live in Siaya and have grown up, we know that girls may be ashamed or embarrassed to dry their pads and their kits within their family compounds. And so one thing that we are concerned about and we hope that we can overcome by providing really good education is that if girls are not drying them appropriately, this can lead to yeast infections and bacterial vaginosis and other types of vaginal infections. So one thing I'm thinking about is if someone does start to exhibit these symptoms and they're one of our the girls in our cohort group, where might we refer them to, especially in this time when our center is not up and running and we're not able to provide medical care yet. So Radha, you don't have to answer this, but just something I'd like us to think about going forward, and maybe LaDaisy and Maureen and Millicent can sort of be working on this as one of their activities. Or I don't know, Maureen, do you have any ideas yet where they might go, or is there a school nurse that would handle this, or what would that look like?
Hi, Sarah. Kindly repeat the question.
Yeah, I'm just wondering if one of the girls that we're working with and that we've distributed a kit to, if they are exhibiting some vaginal symptoms that we think may be possibly attributed to, their misuse of the pad. So, if they were to have some itching, discharge, that type of thing, where might we refer them to be evaluated for care? Or where could we inform their parents, or would this be handled by a school nurse?
Okay. Obviously, we'll leave our contacts with the students or with the school, and in case of such issue, they can always call us. And I believe we can find a health institution where we can take them, be it a public one or even I don't know. We can. I think I don't know how. I think Nick is here, and I
Yeah.
think Matiba will be willing to help us.
Okay, so to be continued on that, and then yeah, one other consideration that perhaps we've started discussions on, but I'm hoping we can sort of clarify, is the issue of parental consent. So I know we had discussed, because when LaDaisy first arrives there, the children will be on vacation. So LaDaisy and Maureen, this is something that you can maybe be working on also, but have you discussed with the schools the topic of parental consent for this group getting the kits, and what does that look like? Could we get all of the parents together, or how might we handle this permission issue?
Okay, about the parental consent, first of all, our initial pilot school, I talked to the head teacher and he was okay with it. So I think I can also do the same for the real now pilot school, and I believe he can show us, the best way to reach the parents.
Okay, great. Yeah, that sounds good.
Okay, a comment on the part that Maureen was trying to answer, that's about reaching the parent, because reaching an individual parent could be at times so haphazard and may not be possible, because it's not something that is being done to one school only. So I think maybe before reaching so many or getting in touch to many schools, the first attempt should be reaching many churches, because getting parents in a church would be easier than getting them through the school. And then there's this part of the issues being raised by the custodian, the pupils, where the main use of the menstrual facilities. I think there will be a bit of challenge when it comes to now getting either feedback, because you find these are the students, they are kids whom we are trying to move from the issue of stigma. We try to make them be people who can reason to each other at their level about menstrual issues. So at this time, we don't opt of having a positive feedback, like having problem, because they will still be shy. So I think the best thing we can do, we can create the challenge with the parents, so that they take also part of the responsibility of sensitizing these children, these pupils at home, so that they get to understand how do they feel using the facilities. Because that people I know, I've come across children when they use the pads, but they have a problem. Some even have a problem on how to use them. But because of shy stigmatization and fear of that social inclusion, you find they may not come up and give the right thing. So I think using the parents would be the most appropriate at the start stage, before they get to understand that menstrual hygiene or menstrual issue is a common thing and it should be taken like any other problem in the society. I think that's my take.
Thank you, Nicholas. Yeah, we appreciate your thoughts so much. All right, well, thank you so much, everyone, for attending. And thank you, Radha. Looks like we had 14 attendees. So again, amazing job on this presentation and these last couple months. And I'm sure we will continue our menstrual hygiene dialogue the next week or 2 weeks before La Daisy goes. All right. Well, thank you, everyone. Have a great Sunday, and we'll be in touch soon.
Thank you so much for coming.